Good morning. I think it's 10 o'clock, so we'll go ahead and get started. Welcome, everybody. My name is Dr. Kendall Portal-U Ward, and I'm here today with my special co-host, TJ Ward, and we're going to talk today about how leaders can help their communities thrive to address mental health and addiction. And this is part of the Project Opioid webinar series that is going on throughout the entire month of June. Next, please. So again, my name is Dr. Kendall Portal-U, and I am the Director of Data Analytics and Strategy for Project Opioid, and I'm also an Associate Professor at the University of Central Florida. I'm here today with TJ Ward, who is with Project Opioid Jax.
Yes, good morning, everyone, and thank you for the opportunity to be here today.
We're excited to have TJ here to talk to us today. And again, a very special thank you to our webinar series hosts. We couldn't have done these webinars without our very special sponsors, the Central Florida Cares Health Systems, LSF Health Systems, and South Florida Behavioral Health Systems. So thank you so much for sponsoring this webinar series that's going on throughout the entire month of June. And I want to make sure that we highlight our upcoming webinars that will be happening in the next couple of days. We've got Dr. Pam Carbiner coming on, as well as a panel discussion of some peer specialists. So we hope you can join us to attend these live, or they're going to be on projectopioid.org after. So please go to projectopioid.org and register and RSVP for those so you can join us. So without further ado, let's talk a little bit about what we're going to do today.
Yeah, as for today's agenda, we have a few questions that we want to answer. You see those on the screen. What is Project Opioid? Why should leaders get involved with this crisis? And then how can community leaders make a difference? So what is Project Opioid? Project Opioid is a coalition of top leaders within a community who are coming together to confront the overdose crisis. And I want to draw your attention to the hub graphic on the screen down in the right-hand corner. You can see in the center is Project Opioid, and then around that circle are different sectors of leaders within the community. And so we want to partner with all sectors within a community, things such as education, healthcare, the nonprofit frontline leaders who are doing the work. We want to partner with government, criminal justice, public safety. But we have a focus on business leaders, faith leaders, and philanthropic leaders. And you may be wondering why that is the case. There are several reasons, but a few of those are they have a unique perspective. So they just think differently. Another thing is that they have an unparalleled platform. When you think about business leaders, they are working with clients. They have coworkers that they have access to, they can share information with. And then the faith leaders have a congregation that they communicate to on a regular basis. These leaders are also problem solvers. So they come up with solutions to complex challenges. And so they are needed in this conversation as well. And then they're proactive. They get stuff done. And so not to say other leaders don't have strengths, but we feel like if we can get these particular leaders involved in the conversation, that we can make a huge impact moving forward. Project Opioid is also a statewide collaboration. We want to unite leaders around Florida. And so there are 6 different regions connected to Project Opioid that are implementing this initiative. And we want to say thank you to the Florida Blue Foundation, because we function as a result of a grant that has been awarded to us from the Florida Blue Foundation. And those are given to the largest markets in Florida. You see them on the screen: Jacksonville, Tampa Bay, Miami, Fort Lauderdale. We have a Project Opioid in Central Florida, and then also West Palm Beach. And so we want to make sure that we are sharing best practices so that we can further the impact that we have and advance the mission, which is ultimately to save lives.
Yep, and I think it's really important to point out too that if you're a leader that's not in one of these areas, we're going to talk today about a lot of things that you can do in your area to help the opioid crisis.
Yep.
So, and that kind of leads us to why should leaders get involved? You know, it's something that I think as TJ and I have worked out in the community, we get a lot is why should leaders get involved? Why is this an important thing? And so I'm going to kind of start this off with a personal story about a friend of mine I actually grew up with Houston, and he is somebody that's been in my life since second grade. He was a good friend of mine and remains a good friend of mine and is now a colleague. So I'm going to play a short video that's going to outline his story for us. And I think it really demonstrates how important this is and how it hits home.
My name is Houston Spoor. I was an opiate addict for 15 plus years. Growing up, had a pretty normal life, played basketball, loved basketball, played that going up through high school and into college. At 16, I had my first encounter with a severe injury when playing basketball. I hurt my back, and that's the first time I got on pain pills. Pain pills that I started off on was Oxycontin. Once I got past my first surgery, my initial spine surgery at 16, I moved on, got off the opiates, but then by 18, I had my second surgery, and after that, it was off to the races. I had 8 more surgeries. By 22, I'd already had a fusion, and by 21, I was severely addicted to opioids. So there wasn't a very long period of time that I had or a chance. It wasn't like one day I decided I wanted to be an opioid addict. It just honestly it happened, and I woke up one morning going, oh my God, I've got an issue. How do I fix this? After my fusion surgery, I had a lot of mental health issues because I almost died. Suffered a lot of anxiety, depression. The opioids became my crutch. I began to use them for anything and everything emotional. Pain was kind of a secondary issue at that point because, I just lay in bed and take pills, and then if I felt anyway, I would take another pill. And so I finally got some help with my father, my mother, my family. We went to my first rehab facility, and I came out completely off every substance. Did well for about a year, and the problem is that I hadn't learned life skills yet. By the time that I went to my final rehab, I was 35 years old, 2015. My mom and my family Marchman acted me because I was on the road to killing myself. I started using IV drugs, I started stealing, I started doing things that I never thought I would do, and I was mandated by the courts to enter treatment. I stayed in there for a year and a half. But the difference in this one was that I was able to utilize medications such as Suboxone, where I could help the pain. That was an issue. And then also help the cravings. And it allows me today to kind of sit here in front of you. If I didn't have Suboxone or medications in general to help me get through this, I think I'd be dead, to be honest with you, because going out now in the areas that I frequented, fentanyl has taken over. And fentanyl has become the #1 killer of white males. It's in my age group and younger. And so it really, scared me, and it scares me to this day. And I lose another person a week, it seems, that I know that just could not find their way out. My family is now my backbone, and that's expanded here of late. My wife, Julia, we are getting ready to have our second child in September, and my son, Cohen, are what keep me going. If I have a bad day or ever think about using, those days go away, those cravings go away, the more you start to realize that there's a better life on the other side.
So I think that's such a powerful story, right? I mean, this is somebody that I grew up with, I spent my childhood with, and to see him struggle was so difficult, and I'm close with his family, but it's amazing, and he made it, and he has made such a success of his life. And so now, though, there's so many people that just aren't that lucky, and we are losing so many people on a daily basis to opioids and to drug overdoses. So this slide up here that we have now is is some data from the National Institute for Healthcare Management Foundation. And what it really outlines is the state of the opioid crisis before COVID-19. And even before COVID-19, which we're going to talk about in a minute, the effects that that had, we were losing almost 200 people a day to overdose deaths. And that's an astronomical number. And there's so many ways that we can prevent it. And there's so many things that business and community leaders can do to prevent people from dying. And so most of those drugs, overdoses, are related to opioids. And as you can see from this graphic, over 50% of them are related to a synthetic opioid. And so that's really something we're going to talk to our guest contributor about a little bit later, but we're really talking about 90% of those involving an opioid in some way, 50% of those involving a synthetic opioid, which are so highly potent and really infiltrated the drug supply in so many ways. So Houston is fortunate that he was able to get out and was able to get help before these synthetic opioids really hit the street.
Absolutely.
And so you can see here that we've kind of had three waves of the overdose crisis. So the overdose crisis really started in the early 90s, mid 90s, about 1996, with the overprescribing of pharmaceuticals, right? That's what we saw. That's what we saw in Houston's story. People were sick and they were overprescribed so many medications, surgeries, and just given so many different kinds of medications. And then we put a lot of policy into place that enabled us to crack down on that and really try to get physicians to stop overprescribing, cut down on the pill mills. In Florida in particular, we had a significant pill mill problem for many years, but we really were able to cut down on that. But there were some unintended consequences, right? So we were able to cut down on these prescription drugs, but what happened is that people turned to heroin. And then we saw a rise in heroin drugs deaths that you can see in this graph that we have up here on the slide. And then, unfortunately, 2015, 2016, we really saw the hit of fentanyl. And fentanyl is a highly, highly potent opioid that we're going to talk about a little bit later, but really infiltrated the drug supply and has had a devastating effect on not just people that were used to using opioids, but people around using other drugs as well. But I mean, I think we can't really overstate, next please, the implications that COVID-19 had, right, TJ?
Absolutely. COVID-19 contributed to the worst mental health, substance abuse, and overdose crisis in American history. And we talked about the unintended consequences. Those caused overdose deaths to skyrocket to a place we could have never imagined. If you think about it, the unintended consequences of the pandemic, things such as isolation, people were alone quite a bit, and obviously that needed to happen to a certain degree to get things under control. But then the loss that was experienced, the loss of loved ones, people that we cared about, people that maybe lost jobs as a result of the pandemic, and then you had the stress that was associated with that, the anxiety, the depression that came with it. And I think about even the uncertainty in my own life during that time. And a lot of people struggled with that and battled against that. And then you think about those who were getting help and the disruption of the treatment during that time. They weren't able to get the treatment that they were used to. And because of that, some of them relapsed. And then you had people who weren't using, who began using in order to cope with all of the things that occurred as a result of the pandemic. So those things really combined to cause these overdose deaths to just get out of control. So if it was an issue back in 2016, 2017, I know in Jacksonville, where I'm from, our city council enacted a task force called Project Save Lives back in 2017, 2018, because it was an issue. And so now, we fast forward to 2020, and it's just compounded so much more than even during that time. So we need all of the help that we can get from community leaders to help make an impact in this and really to get people the help that they need.
Absolutely. And I think, one of the important things is that during the pandemic, not only was, our people isolated and unable to get, their medications. They're unable to get treatment. We did some research at Project Opioid in Central Florida and really found that people felt like they couldn't get treatment, that everything was about COVID, and they really felt uncomfortable really reaching out and trying to get treatment as well. Yeah, so it's really compounded an issue that's already been out there. And so this is why it's so important that we get leaders like those of you that are on this call that are in the field or in other fields to really get behind and work with us. And I think the other important piece is that the pandemic really also changed who was being affected by the overdose crisis. We saw an increase in African Americans and Hispanics dying from overdoses. We also saw that the pandemic disproportionately impacted those as well. So all of the available data shows that people that were dying from COVID-19 were more likely to be opioid users. Yep. So people that were already using opioids, had compromised lungs, were more likely to die from COVID-19 as well. So there's a lot of factors working together during the pandemic as well. So in Florida, we have some additional data from the Florida Department of Health that really helped highlight this chart right here. You can see really helps highlight exactly what was happening with overdoses during the pandemic. As you can see, we had a huge spike in the number of people that were overdosing and dying during those quarantine months. If you look at the dotted line, that's the projected number of individuals that died of all drug overdoses during this time. And these lines down here are 2018 is the blue and 2019 is the gray. And you can see that it's just a huge number of people. It's a huge percent increase, 30 and sometimes 60% increase in year over year number of people that were dying. So it's really highlighted and become such an important issue for leaders in business, faith, and philanthropic organizations to address as we move forward. And one of the major pieces is this increase in fentanyl. This is the number of increases in fentanyl deaths in Florida. You can see between January and June of 2019 and January and June of 2020 that we've seen a huge increase in fentanyl deaths. And so that's really highlighting just what's going on in our street drugs.
And you mentioned the increase in minority populations, right, and this is one of the hugest contributing factors to that.
Absolutely.
Fentanyl is now in everybody's drug of choice.
Yeah.
Those drugs are being laced with fentanyl, and people don't know what they're getting, and they're overdosing at incredible rates.
Absolutely. Yeah. Fentanyl is so cheap to get and it's so readily available that drug dealers are able to put it into other drug supplies like cocaine, like methamphetamines, and to increase the high and to increase the dependency. Yep. And people don't know what they're getting.
Extremely addictive.
Extremely addictive. Yeah.
And we even have reports of drug dealers actually passing out Narcan with these drugs because they know that there is a great chance of people overdosing, and saying, look, if you're going to get high, have somebody there with you that can administer this Narcan if you do overdose, because they know if they get them hooked, they're hooked for life.
Right. Absolutely. And what it can really do is it really can disrupt the whole supply chain of narcotics and everything that's going on. And it has such a huge impact on businesses and on the economic and employer factors. So, there's a lot of estimates out there, but a very widely accepted one is that the federal government is estimating that it costs almost $79 billion a year to deal with the opioid epidemic and with all of these drug overdoses. So that is a huge amount of money that we're spending on the back end, as opposed to try to do some of these preventative things, such as provide medication-assisted treatment, such as provide Narcan, some harm reduction strategies that we can do to save lives and have a positive economic impact on Florida and on the United States as a whole.
Right.
Yeah. And so we hear from a lot of employers that say, but not my employees, right? Like, no, my employees are coming to work and they are functioning, and, this can't possibly be implicating my employees, but that's not true, right?
Yeah. So one of the misconceptions is that people who are addicted to these drugs can't function.
Right.
But we see, CEOs who are functioning addicts and people that can go to work. However, we know that depending on which source you look at, between 1 in 5 and 1 in 10 employees will struggle with some type of addiction to an illegal drug, an illicit drug, or alcohol.
Right. I mean, there's a lot of stories about physicians that suffer from this and get addicted to their own medications and continue to function and continue to come to work. So one of the things that we're really trying to do is get to people and get to leaders such as the individuals watching this call and watching this webinar to educate them on what they can do to help and what they can do to recognize these signs in their employees. We've got some webinars that were done by some physicians that help employers recognize the signs of addiction. So I highly encourage everybody that's watching to go back and watch those on the Project Opioid webpage, just because it can happen and it does happen for sure. So next up,
yeah. So this time we want to introduce our guest contributor. Her name is Kathleen Roberts. And Kathleen is the Executive Director of Community Coalition Alliance. Kathleen Roberts has worked in the field of substance use disorder prevention for over 15 years. Prior to her role as Executive Director of CCA, she was the clinical team lead at the Department of Children and Families Office of Substance Abuse and Mental Health, and served as the SAM clinical team lead, as well as Florida's National Prevention Network designee. And I can say that Kathleen has been a real friend to me since I started this work about 3 months ago. She was one of the first people I met in this space, and she has done a tremendous job of helping educate me, as well as connecting me to frontline leaders and service providers in this work so that I can learn and continue to grow in my knowledge of this. So I want to welcome Kathleen to our webinar here today. Thanks for being here, Kathleen.
Thank you so much. It's a privilege to be here.
And we're going to ask you a few questions and lean into your expertise in this area. So I'll get started with this one. Statistics suggest, as we mentioned, that 1 out of every 5 employees struggles with an illicit drug or alcohol addiction. What can business leaders do to help reduce opioid addictions and opioid-related overdose deaths?
And that's a great question. And I'm so glad we're having this opportunity to have these conversations, because when it comes to the opioid crisis, every single part of our community plays a role. And that goes all the way from our law enforcement, our healthcare, but also in the business community. When we think about businesses and what you're looking at to grow the different companies, the economics of it, there's a lot that goes into it with the good qualities of products and services, but a lot of it too goes to the labor force and making sure your labor force is healthy, that they're living safe and happy lives so that they can contribute to your company. So as we're thinking about how the opioid crisis is impacting our communities, it's happening across where we're feeling it at every part. And so businesses here can take this opportunity to take a step of an active partner to deal with how to better help their employees and also the community. The opioid crisis and dealing with addiction causes a lot of problems, including increase in absenteeism, loss of earnings, productivity, on-the-job injuries, increased health insurance costs. So there's a lot of things that we see as a problem, but there are a lot of things that can be done as well. The first step is changing the conversation. So substance use disorder is a preventable and treatable illness. And if we can begin the conversation to say it's okay to ask for help, that is going to open doors for a lot of new possibilities. Being able to embrace that there are ways that we can provide more support will be beneficial. Taking a look at your internal policies. What can we put in place to help employees be able to reach out for assistance, be able to take advantage of resources that are available, looking at ways that we could help promote wellness and enhance self-care, support long-term recovery. All of those pieces are things that businesses can take a look at for each of their own companies. And then we can look at it as a practice as a whole. Another piece that's going to be important is we've talked a lot about naloxone as a great tool for reversing overdoses. If we can have that tool be available everywhere in all of the safety supplies that we have at businesses, that's yet another way to normalize the conversation and have this available. We can also help to provide information. There's always opportunities for workforce development, and you bring in so many different topics. You talk about wellness, you talk about mindfulness. This is an opportunity to talk about this conversation and really open up that communication along the way. And also being able to make help accessible. So encouraging your employees to use their health insurance and the employee assistance programs, whatever the case may be, so that we don't have this stigma continue to be a factor.
Absolutely. And you mentioned naloxone, which is also the brand name is Narcan. And we haven't really talked much about that. So do you want to explain a little bit about what Narcan is and how it works?
Yes, absolutely. And Narcan is a fantastic resource and available thanks to a lot of different programs going on, especially with the Department of Children and Families that make it available for free, because it is a pretty pricey product, but it helps to reverse an overdose. So it's a medication that temporarily blocks the effects of an opioid during an opioid overdose emergency. And that's not necessarily meaning that you take it and then you never have to worry. You always have to make sure that you're also reaching out to 911 if such an emergency happens. But it is a life-saving tool that we should all have readily available, regardless of where you are in your community. And if we think about that as a key part of like our first aid kit, you think of, EpiPens, having those available. You think of all of these things in case of emergency. This is yet another one of those great products you can put in there.
Absolutely. The city of Orlando actually has taken Narcan and put it in all of their AEDs. So every AED in the city of Orlando now has a tourniquet kit and Narcan, because exactly like you said, it's just like an EpiPen. It's just like a fire extinguisher, right? You hope you never have to use it, but you're sure glad you have it if you need it.
Yeah,
absolutely.
Kathleen, if you don't mind, we'll continue to leverage your expertise in this with a couple of follow-up questions in relation to Narcan. So sometimes when I talk to people, they're concerned that they're going to do it wrong. They don't want to administer it because they're afraid it's going to harm the person who is, experiencing the overdose. And in addition to that, they're afraid that there's liability associated with that. Can you kind of dispel some of those misconceptions?
Absolutely. And this has been one of those that we've had so much conversation on and done a lot of work to change that mindset of that there is a downside to using the Narcan. There is no downside. You can use it even if what is happening is not an opioid overdose. If you administer it on the individual, there is not going to be a negative effect. It is much better to take the chance that that is what's happening, to go ahead and use it, than not to use it at all.
So it can only help and not hurt, right?
Correct. Yes.
Can you overdo it?
No, you cannot overdo it. And then if you use your first dose and you still don't see the individual revived, then you can go ahead and use another dose. There is no downside to being able to use those. And the upside is you're going to save a life. And that's really what the focus should be around.
Absolutely. And some of our business leaders have expressed concern about having Narcan around, and then maybe people will choose to come get high in their establishment. Have you seen anything like that, Kathleen?
That's a myth that we've been trying to dispel. Just because we make Narcan available, that does not increase the likelihood of use. It doesn't encourage more use. There have been a number of research studies that have gone out there to look at that, and that's not the case of what happens. What does happen, however, is you save someone's life. And every life saved is worth it, because then you're giving them the opportunity to make the next decision in their life. If you don't, they will never have that opportunity again.
Yeah. Hey, can we talk about a different product? It's one that you introduced me to the very first time we met. I don't know if you remember this, but you brought it to me. It was a packet called Deterra. Yes. Can you tell our viewers about Deterra?
Absolutely. So just as Narcan is a fantastic resource, Deterra is yet another one. Deterra is a drug deactivation and disposal kit. What it does is it's a pouch that has a chemical compound, and I'm not going to go to the specific chemical pieces. I am not a chemical engineer, but that you can go on their website and find all those pieces. But you put whatever your medication, be it an opioid medication, stimulant medication, it can be an antibiotic. You pour your medication into it, you pour some water, you can hear the effects happening, you wait 30 seconds, you close your pouch, you shake it up, and you throw it in the trash. And so what this pouch does is it neutralizes whatever that medication is. And what that means is if there was a medication like an opioid, once it's in there and it's been deactivated, you can no longer take it and use it and get the effects of that opioid.
So why are some of the reasons this is really important? Because so for instance, I talked with somebody recently who their loved one was in a hospice situation. They were getting care at home in the last days of their lives. And then when that person passed, there were all of these medications that they had been taking, and the family did not know how to dispose of it. Fortunately, they took it to a pharmacy and they were able to help them. But can you explain some of the reasons why this is so important, and some of the ways that if we don't dispose of these things in the right way, it could really be a detriment to, people within our community?
Absolutely. And there are a couple of reasons why we want to remove excess medications, whether they are expired, they're no longer needing use. Is one, it removes it from access and availability from anyone within your house. And that is for your house, for somebody coming to visit your house, whatever the case may be. When we remove the access to those medications and that availability, it reduces our chances of overusing it. It reduces the chances of beginning use for those that are new. There is a lot of statistics out there that show, about 60% of individuals that are prescribed pain medications still have unused medications sitting in their medicine cabinets, bathrooms, wherever that they store it. And what we've talked a lot about, especially with the pandemic coming in and people being home more often and being stuck in there, and that availability just sitting there more than before, can get access to either your youth that shouldn't be using it, individuals that the medication was not prescribed for, or you using it for what it's not intended for. So once it no longer serves its purpose or it's expired, it's best to just get rid of it. And you don't want to just flush it down the toilet. You don't want to just throw it in the trash. With the Terra, it makes it so that you can throw it in an environmentally conscious way.
Right, absolutely. And even though there is less prescribing of opioids now, that's still out there. And that is oftentimes the way that people get that first, addiction is through prescription opioids. To go back just for a minute, Kathleen, we had a question from one of our viewers who said that they heard that patients can become violent after receiving Narcan. Can you speak to that at all?
So there are some times that the reaction becomes that way when they're going through withdrawal. And we have heard things like that when, especially with first responders arriving to a scene. However, it is at least that they're still being able to be alive is the key piece right there. What we want to make sure that we're doing and educating to those who are listening in is the focus should be saving a life. What happens afterwards, that's why it's so important to call 911. It's so important to get medical attention to make sure that the individual is being treated and that there aren't any additional concerns that could happen.
Right. And if you're interested in getting Narcan for your business or for your personal use, maybe you know someone that you're concerned about, you can go to projectopioid.org and you can request it, and we will have it sent to you free of charge. And there's also educational videos that talk a little bit more about what Kathleen was talking about in terms of all of the, how to administer it, calling 911, et cetera. So I think there's some really great information on Project Opioid's website as well. So thank you very much. So Kathleen, to go back to another term that we've kind of been talking about a lot this morning is fentanyl. And so the term fentanyl has become recognized. We've used several times in this conversation. Can you tell our viewers what fentanyl is and how it plays a role in all of these increases we've seen in overdose deaths?
Absolutely. So fentanyl is a powerful synthetic opioid, very similar to, say, morphine. Difference being it is 50 to 100 times more potent. So there is a medical side to it. So is the fentanyl as medication that is used to treat patients that have severe pain, especially after surgery. That comes in like a shot or a patch or even a lozenge. But the concern that we have on the fentanyl side when we talk about fentanyl is the illicit fentanyl that's being made in labs. It's on the streets. They come in the powder format, dropped into blotter paper. They can even be put into eyedroppers, nasal sprays, and then also even made into pills that could look like prescription opioids. So those are the elements that we are, when we're talking about the fentanyl, the rise and increase, that's what we're talking about here. Fentanyl works by binding to the body's opioid receptors, which are found in areas of the brain that control pain and emotions. It is extremely addictive because the potency is so high. So thinking about, morphine being a very strong opioid, and fentanyl, I'm telling you, that is 50 to 100 times more. And every time we look at, some of the stuff that's coming in, it's even higher. So that potency is what's so dangerous. And it is now starting, as TJ had mentioned, it's starting to be mixed in with other types of substances. So it's being made available and used as a cutting agent. So finding it within cocaine, methamphetamine, and even marijuana in a couple of instances. Looking at the drug seizures, there's been a 240% increase in seizures that have had fentanyl and fentanyl analogs. And so it has moved to the top of the drug threat. The death toll caused by it has been tremendous, and not just, at the national level, but looking here in Florida, especially in the region I'm in the Northeast region, where that has been a serious issue.
Yeah. Yeah, at this time, the medical examiner's report came out, and fentanyl has outpaced alcohol as the #1 drug in the bodies of people that died in the first 6 months of 2020. I mean, that's an amazing statistic. I mean, we've always looked at alcohol as being, you people do alcohol and other drugs, but now fentanyl has gotten into so much of the drug supply that it's really overwhelmed.
Yeah. Hey, Kathleen, one of the questions I get often when I share information about fentanyl with people is, why would drug dealers put that in their drug supply if they know it's got a high chance of killing somebody? Why would they want to get rid of their customers? Can you speak to why they would do that?
Well, I can't be in the minds of every person, of course, but part of it is that potency level of having that more of that euphoric flavor, euphoric effect much faster. And so also when we talk about addiction and substance use, that tolerance level begins to happen at a certain point. And so they're always looking for what's that next level up. And so when they can introduce that, it helps it to meet some of the demand that's out there and get folks to come back when able to.
So if they can keep them alive, they've got a customer for life, is basically what it amounts to. All right.
Yes.
And what role do you think fentanyl played in the overdose rise we saw during the pandemic?
So definitely a part of it, but the rise also is because of a result of the pandemic's effect on our lives. We've talked a lot about that here in our Jacksonville area. We meet monthly to discuss the substance use rates with opioids and other substances as well. And we've continued to talk and address the issues of unemployment, the stay-at-home orders, the anxiety, depression that has come out. You throw in the fear factor that went into that, the isolation, all of those factors were kind of amplified, and then add in the fentanyl. It was just yet another ingredient to this mixture that really just exploded. We're continuing to see in our area that increase in the overdose calls. We monitor it each month. Luckily, we have a great partnership with our Jacksonville Fire Rescue that is able to look at it and share with us with all the community partners to see what's happening month to month. And we can see that, we're back open, we're meeting, but that the numbers are continuing up. February, March, April, May, the numbers have been escalating each month.
So moving on to another question, and thank you for the information that you provided in that segment. What kind of coordination should there be between law enforcement, county departments of health, and departments of children's and families managing entities, those that fund behavioral health needs, to get people as quickly as possible the help that they need?
That's great. And it's not a simple answer because it's a multi-pronged approach that we need to consider. And there are so many different things that have to be happening. One thing that we definitely need is more of the focus around transitional programs for individuals leaving prison and jails, coming in to find ways to connect with supports, connect with treatments, connect with a number of different resources available in the community. We keep seeing within our research that studies show an increased risk of overdose for individuals leaving incarceration. That's 40 times higher to overdose than the general population within the first 2 weeks of leaving. So having some sort of a program that we can connect individuals leaving to the treatment, the supports, that's critical. Housing is by far one of the most essential components to addressing this issue, especially when it comes to sober living communities. We have here a lot of discussion going on. It's hard to even think about what treatment looks like and what those needs are when you don't even know where you're going to be living, or you don't even know how you're going to pay for things. And so having those types of supports in place and being able to connect the law enforcement, the community partners, all of those to be aware of these services that are available and being able to connect individuals back to those services. So when you run into you find someone that is needing help, you can connect them to what is there. And also being able to have those ongoing conversations to move away from that stigma. We need to move away from looking at like the halfway houses as a place of illegal activity, and instead thinking of it as a place to provide support and ongoing assistance to individuals trying to move through their recovery process. Being able to introduce medication-assisted treatments and to more individuals will be critical. Having the support for peer recovery support. Peer recovery support services have been an evolving piece of our community that I think has gained a lot of great attention, and continuing to promote that. And those are individuals that are in the recovery and they're able to speak to individuals from their own experiences and understand where they are and meet them where they are. And I think that is also very important for all of us to understand and appreciate. And then also being able to do more of those community engagements and training. Like webinars like this are great. It's helping to increase that awareness. It's helping to bring information that otherwise people would not be aware of. But adding to those, having those resources like Narcan, like the Terra being distributed out to the community across different partners is also another important component. And also being able to look at policy changes. As one thing that the pandemic has taught us is things can change in an instant. So we need to be able to adapt as well and change. We know we have an issue when it comes to opioids and really substance use in general. This is just the topic that we're focused on here, but we have substances across the board that are a problem. But then we can think of what are some policies that we can put in place that could help connect individuals to available services and treatments. It can also help to make the place of business more open and acceptable of what conversations need to be, help employees be able to feel comfortable reaching out for help. And so that we don't just go back to how we've been of putting the blame on the individual. Substance use, we need to think of it in health terms, not as a morality of choice terms. And I think once we start doing more of that, and we've talked a lot about the adult population, but we also have to remember youth. Youth is another piece that it's important to make sure we're having those open conversations with our families. It's important that we make sure that we're putting in safety guards in place and that we're making things that are easy to access for information for youth, get information, get connected to things. One of the things that's so exciting to see in our state is the evolving role of the recovery high schools. That has been a great support for so many, so that you can help youth that are struggling with this to find ways to overcome and move through their recovery process and see what is ahead for them. Yeah. So it's kind of a hard question to answer because it's so many things will have to happen and so many partners. And that's why these calls are so great is that we help to say we all play a role in this. We all have a part of that solution. And if we're all coming together, we'll start to see the change happen.
Yeah,
Absolutely.
I think sometimes it's very overwhelming when you think about all the things that need to happen, but if we just take things one step at a time and engage who we can and continue to make progress, before we know it, we are helping save more and more lives. And I think what you said is exactly on point. It takes everybody leveraging their strengths to be able to make a difference and an impact in this regard. So
Absolutely. And Kathleen, you mentioned a couple of really important topics, big topics: medication assisted treatment, peer recovery specialists. And I just want to say we don't have time to get into all the specifics of all of those things, but we've already done some webinars on medication assisted treatment that are going to be available on projectopioid.org, and that we've got an upcoming webinar on peer support specialists. So if you go to projectopioid.org, you can register for that as well, because those are such important topics and they deserve their own hour for sure. Very important things to talk about. So just one more question for you, and this is a big one, Kathleen, but from your perspective, what are our greatest challenges as we move forward and we try to confront this crisis, as our business and our faith leaders try to confront this crisis in our communities? What are our biggest challenges?
Yeah, that is a big question. So we have a few, well, definitely more than a few, but stigma continues to be one of those challenges that we're faced. It's still very easy to put blame on the individual and forget that that's a person we're talking about, and that we're talking about a health-related situation. So substance use disorder is a health-related, not a moral. So moving to understand that, and not just to say that you understand it, but to put things in place and actually be able to be open about conversations. So when someone reaches out and says, I need help with this, you connect them to that instead of trying to not bring them in. Also, the issue of how do we connect to supports and services? There are services out there. We have the great benefit that we have managing entities across our state that work with providers to bring things in, but sometimes making sure everyone in the community knows what those services are becomes an issue. We need to do more of that awareness of how to connect, where to connect, and bring all those pieces together. So that is important, but it's also the other barrier that we're continuing to see here is related to housing. And housing in general has been always a concern when it comes to like homelessness and things. But for someone that's trying to move through the recovery process, housing can become very difficult. There's more need for the sober living homes to be available for individuals so they can find a place that is safe for them to move through that recovery, and then being able to find a way to pay for it, especially when we're talking about people leaving jails and prisons. It's how are you going to be able to find the funding to pay for your rents when you first have to figure out where you're going to work and all of those things. So if we can have more support towards those kinds of pieces, that's going to be critical. Being able to access treatment. One thing that has helped during this pandemic is for us to think outside the box of how do we connect individuals more. That telehealth has come out as being a great piece of a resource for individuals to access, but also thinking through what else can we do that's different. And that's also being able to bring behavioral health as a key topic to different partners that are going to interact with community members. So to law enforcement, first responders, all of those. We're hearing of great pilot projects that are happening that are introducing either peers to go on ride-alongs, telehealth options that law enforcement officers can take tablets with to have that piece. But if we don't have ways that we can connect, it's going to be very difficult to help get supports and services. So as we have more of those conversations, really needing to move past the stigma. We say the word stigma a lot, but we have to actually move past it and really have that happen. And so more of that education, more of bringing everybody to the table, understanding what recovery is, what that looks like, understanding what peers are and what role they play. And as you said, you're going to be having a webinar on that, so that's fantastic. But without some of those things, it's going to be very hard. And yes, the pandemic had an influence on our opioid crisis and the overdose calls, but we were already seeing increases before that. Our numbers from 2019 were already higher than our 2018. They were already starting to resemble what we were seeing, in the 16, 17. So we have these things that we need to figure out, how do we help address? How do we address the housing piece? How do we make the access to the treatment more available, and also in a way that people don't have to feel ashamed that they're looking for treatment?
Absolutely. And I think that's it's such an important message for this audience in particular, as we're talking to our leaders, as our community leaders, our business, our faith leaders, that they can make a difference and that they can reduce stigma, and that they have such a powerful voice, especially when your boss, when the CEO of your company comes out and says it's okay to ask for help. That's a powerful statement. When your faith leader stands up in front of the congregation and says, ask for help, it's okay, that is hugely impactful to individuals. And that's really why we're trying to get this message out. So Kathleen, thank you so much for joining us today.
Thank you.
Amazing, a wonderful resource. We so appreciate your time, and we look forward to talking to you again soon.
Thank you so much for the opportunity.
Thank you, Kathleen. So, and this is a great segue into our next little video we have from the co-chair of Project Opioid, CEO of Red Lobster, Kim Loptrup, who has done some amazing stigma reducing things in Red Lobster. He's really reached out and made some amazing changes. So we've got a quick video from him.
Hi, I'm Kim Loptrup, CEO of Red Lobster. A lot of you probably think of us as being in the seafood business. I think of us as being in the people business. We have tens of thousands of employees, and we try very hard to be a great employer, because honestly, whoever attracts and retains the best employees generally winds up winning in casual dining. One of the things we care a lot about is treating our employees well, so that they will be loyal to us. One of the obvious needs in recent years has been to help protect our employees from this opioid epidemic that's been taking place even before the COVID-19 pandemic. Opioids were killing more people than auto accidents in the United States. And often it's because people were just following doctor's orders. If somebody takes an opioid drug for 1 day, they have a 6% chance of becoming addicted. If they take it for 30 days, they have a 35% chance of becoming addicted. 80% of heroin users got started by taking prescription opioids. A number of employers have banded together with Project Opioid to help identify and share best practices. First is educating our employees. We educate them about the risks of opioids and also alternatives for those who are already addicted. So early in this crisis, it looked like an unsolvable problem. It is now becoming clear that opioid deaths are a solvable problem. We can actually prevent most people from becoming addicted in the first place. If they are addicted, medically based treatment can allow them to return to being fully functioning employees almost immediately. If somebody's actually had an overdose, they can be brought back and revived with a very high success rate with naloxone. The trouble is, awareness of what to do and access to some of these solutions is still very limited, and there's a tremendous amount of work to do. And that's where Project Opioid comes in, and that's why we're asking you to get involved. You can make a big difference to your employees. In fact, you can save lives and also greatly improve the quality of the lives of your employees and improve their productivity, improve their ability to show up and be at their very best every day. We're asking you to get involved in Project Opioid and help make a difference for your employees too. And I think you'll be glad you did. Thank you very much.
A big thank you to Kim. He is such an amazing advocate for reducing stigma in the workplace and really helping his employees, and just an amazing CEO all around. So TJ, we have a few minutes left. Let's talk a little bit about, I think we've laid the scene. So how can all these leaders make a difference?
Yeah, what can you do? Whether you're a part of Project Opioid or not, what can you do to make a difference? And here at Project Opioid, we do have a framework that we believe works. And these aren't things that we have invented. But we feel like these things are effective when it comes to addressing this crisis. And the first one is to align cross-sector leaders. Build a coalition of top leaders within your community to come together and to make a difference in this, to leverage their strengths, to leverage their skill sets, to really make an impact in this crisis that we are experiencing. Second thing, educate and increase awareness. We talked about the fact that people have questions about this. And as I'm learning and as I'm talking to people all over Duval County and Jacksonville, where I'm from, I'm noticing that there are two categories that people usually fall into. One of those two categories, and they are very familiar with it because either they've been through this themselves or they know somebody that they care about greatly who is struggling with this. And then there's another category of people that I would say I fell into before I started this work. And that is, they know about opioids, but they don't understand the significant impact that they're having on people's lives and in our community. So it's our job to really educate and bring awareness to this. And Kathleen talked so well about shattering the stigma that is associated with this. There are so many myths that need to be dispelled. And as we continue to communicate those as leaders, people will become more informed. Another thing is create and share data. That's so important. I think of the needs assessment and just identifying the most vulnerable populations within the community that you lead in, and just finding ways to help them, finding ways to contribute to their success and their treatment. One of the things I love about the Project Opioid model is that it is reproducible. And there are some things that you can do no matter where you are, but it's also flexible. And what I mean by that is you can contextualize, to your specific demographic. So you can add things into what we're doing, and you can do some things that based on your needs assessment, you understand have to be addressed. And then you can also leverage the strengths of the people in your coalition to be able to make a difference. So I would encourage you to start to implement some of these things, to formulate high impact strategies. That's another thing. Strategically gather those leaders within your coalition, determine effective solutions that are going to help in the area in which you live, and then create action steps and put those into place so that we can drive change and save lives. Because ultimately, that's what this is about. People can't get the help they need if they're not alive. So we want to save lives. And then lastly, advocate and coordinate. And so when I say advocate, I'm talking about advocating for frontline leaders and service providers that really are making a difference, that are having an impact and that are effective in the work that they're doing. We want to help them get more resources so they can continue to do the job that they're doing. And then we want to advocate for those who don't have access to resources or treatment that they need. And then coordinating with stakeholders to force multiply our impact. We are so much better together than we are apart, working in silos. So we want to bring together leaders, be cohesive in our efforts, and really force multiply the impact that we can make to reduce the number of overdose deaths that we're experiencing.
Absolutely. Thank you so much for that quick summation. I know that I want to be very aware of everyone's time, but I think the take-home message here is that leaders like those of you that are on this call can make such a significant impact by just helping reduce stigma. Get involved, recognize that this is an issue. If you need help, if you want to get involved with Project Opioid, reach out to us, projectopioid.org, and we'll be happy to help, and we'll be happy to set you up with somebody in your community. If you don't have a Project Opioid in your community and you just want to hear about how you can actionize these steps that TJ laid out for you, that's great. We're happy to help you do that as well. At the end of the day, this really comes down to how we can all work together to save lives. Yep. And so again, a huge thank you to our series sponsors, the Central Florida Cares Health System, LSF Health System, and the South Florida Behavioral Health Network. Without them, these couldn't be possible, and we wouldn't be able to reach out to as many of you as we have been today. So we've got a couple of more webinars coming up. Please visit our website and register for those. If you have any questions, there's a contact us button there. And again, a huge thank you to TJ for coming to Orlando and joining me today. And thank you all so much for joining us.